Hi, and welcome to the Q in Use training video. Let's dive right in so you can get started using the Q needle tracking system today. We'll start by activating the Q-compatible needle. Place the tray containing a compatible needle, like this PowerGlide Pro, on the Q activator. Ensure that the tray is fully in place and facing the right direction, making complete contact with the activator. When the needle is activated, the following will appear on screen. At this point, you can remove the tray from the activator. Drop the needle into your sterile field and proceed with your normal insertion prep. Before you begin your procedure, check the performance indicator to ensure there is an adequate magnetic environment for needle tracking. You can find the performance indicator on screen here. More bars indicate a cleaner magnetic environment for detecting an activated needle. If the performance indicator is low, look for metal and magnetic objects and remove them from the field. These could include watches, jewelry, mobile phones, pumps, and bed rails. Once ready for insertion, begin by introducing the needle to the probe at a typical insertion angle, about 45 degrees, until needle tracking appears on screen. If tracking does not initialize, temporarily increase the needle angle to pair with the probe and initialize tracking. If it still doesn't begin tracking, separate the needle from the probe. Confirm that the performance indicator increased, and then reintroduce the needle slowly. Once tracking is up and running, approach at a typical insertion angle, about 45 degrees. You should see guides for your needle depth, the target intersection window, and the needle trajectory. As you can see, the location of the intersection window, the area on the ultrasound image that the needle is targeted at, changes as you move the angle of the needle up and down or adjust the distance between the needle and probe. When the needle is visible beneath the probe, it will pass through the intersection window. To begin insertion, position your needle so that the intersection window is aligned with the target vein. When you begin to insert the needle, you will see the solid depths lines, representing the needle's real-time depth. Track the tip down to the intersection window, allowing you to anticipate when your needle will reach the vein. Once your needle has reached the intersection window, you will see a white dot showing your needle tip in the vein. At this point, you can proceed with any needed further insertion and catheter deployment. And there you have it, a clear way to plan your path and control your needle throughout the process that's designed to be better for you and your patients. The SiteRite 8 ultrasound system is intended for diagnostic ultrasound imaging of the human body. Specific clinical applications include pediatric, peripheral vessel, and vascular access, small organ, breast, thyroid, parathyroid testicles, musculoskeletal, conventional and superficial, and cardiac, adult and pediatric. Typical examinations performed using the SiteRite 8 ultrasound system include vascular, assessment of vessels in the extremities and neck, for example, jugular, carotid, leading to or coming from the heart, superficial veins in the arms and legs, for example, basilic, cephalic, brachial, femoral, radial, saphenous, and vessel mapping. Assessment of superficial thoracic vessels, for example, axillary, innominate, subclavian. Vascular access, guidance for PICC, CVC, dialysis catheter, port, PIV, midline, arterial line placement, access to fistula and grafts, and general vein and artery access. Interventional, guidance for biopsy and drainage. Superficial, assessment of breast, thyroid, parathyroid, testicle, lymph nodes, musculoskeletal procedures, for example, joints, ligaments, tendons, soft tissue structures, and surrounding anatomical structures. Q needle tracking system and Pinpoint GT needle technology are each intended to provide visual needle tracking to assist with ultrasound-guided vascular access. Q needle tracking system is available on SiteRite 8 ultrasound system. Please consult product labels and inserts for any indications, contraindications, hazards, warnings, precautions, and directions for use. Federal USA law restricts this device to sale by or on the order of a physician. Warnings: use only Q needle tracking system compatible needles with the Q needle tracking system. Use of unapproved needles may result in patient injury. Misuse of the Q needle tracking system may result in damage to the equipment or personal injury. Q needle tracking is not qualified for use with SiteRite needle guides. Using SiteRite needle guides with Q needle tracking may result in injury to the patient. The Q activator contains strong magnets which may affect devices sensitive to magnetic fields. Cautions: keep the needle and any ferromagnetic objects, for example wired undergarments, metal instruments, watches, jewelry, Q activator, electronics, metal bed rails, etc., at least 3 feet away from probe when calibrating. Failure to do so may impact the accuracy of needle tracking. Equipment operating in close proximity may emit strong electromagnetic or radio frequency interference, which could affect the performance of this device. Avoid operating the device near pumps, cauterizers, diathermy equipment, cellular phones, or other portable and mobile radio frequency communications equipment. Maintain equipment separation of at least 3 feet. Excessive movement of the probe may result in a temporary loss of needle tracking. The activator produces a magnetic field. It should be kept away from any device that is sensitive to magnetic fields. Follow all care, handling, and/or installation instructions included in this guide and on the packaging provided with the activator and needles. Single-use items, for example needle trays, needle guides, needles and sheaths and covers, must not be reused under any circumstances. Movement of the probe during calibration may result in calibration error. If needle tracking is not functioning properly, discontinue use of Q needle tracking system. Improper technique and environmental conditions may introduce variation in accuracy.